The principle that I follow in my practice in pediatric deformity is to get a very, very large correction of a deformity with a very, very short fusion. And in my practice, this is a patient, we had to remove, a section of rib. We had to make a series of cuts at the stiff central part of the curvature, and then with a series of specially contoured rods and bending and compressing the rods, we're able to get the spine very nicely straightened out. And what I do in my practice is I try to avoid any type of fusion of the lumbar spine. If you can correct the curvature in pediatric deformity in the thoracic spine and preserve all that motion in the lower back, then patients are able to run and play sports and essentially have no limitation. That's my goal when I treat deformity. Those are the principles that I follow in pediatric scoliosis, and by getting large corrections of the angular deformity with very, very short fusions, then you can really achieve great outcomes, and patients will do really well.